Hello everyone, it's Michael Phillip, your physical therapist who is here today to talk with you about spinal surgeries for the treatment of lower back pain. In a previous video, I discussed conservative treatment options, but if you found yourself exhausting all those options and still have not found relief from your back pain, you and your doctor may now be discussing more invasive treatment options. If you are considering a surgical option, I would do your research and speak in depth with your doctor on the procedure and the outcomes. You need to understand that every patient is different and thus every outcome is different, so you need to understand the risks. And as most doctors would agree, the stronger you go into surgery, the better you do coming out of surgery. So if the surgery is on the table, I would look into doing at least a month or so of physical therapy first to make sure your recovery is as quick and painless as possible. Now, on to the more invasive treatment options. The first one I want to talk about is minimally invasive, and most don't even call this a surgery. But I put it in this video because it is a more invasive and permanent treatment option over a simple injection. It's called a rhizotomy. A rhizotomy is a neurosurgical procedure that selectively destroys problematic nerve roots as they exit the spinal cord. It's typically performed on an outpatient basis using a simple probe to apply a radiofrequency wave to the impinged pain-causing nerve root lying between the facet joints and the vertebral body. A facet rhizotomy injection is successful in providing lasting pain relief for approximately 50% of the patients. The goal is to reduce the pain so you may resume normal activities and begin a physical therapy program. And now on to the more common surgeries. First, you have a discectomy. This involves removal of the herniated portion of a disc to relieve irritation and inflammation of a nerve. It's typically done with a small 2-inch incision on the lower back in which they use tools to remove the portion of the disc that is herniated. It is also common to perform this surgery with a laminectomy and or spinal fusion. And now on to the laminectomy. A laminectomy is performed by removing a portion of the bone in your spine, which will allow for decompression of the affected nerve that is causing your pain. It's most common associated with spinal stenosis. It is the least invasive of the surgeries, but still may require several months of physical therapy following. The success rate of a lumbar laminectomy to alleviate pain from the spinal cord is generally favorable. Following a laminectomy, approximately 70 to 80% of patients will have significant improvement in their function, their ability to perform normal activities of daily living, and a marked reduced level of pain. Then there are spinal fusions. Spinal fusions require permanent removal of the disc that is herniated and fusing the two spinal levels above and below that disc with bone graft, metal screws, plates, or cages. It's fairly routine and can be very effective and quick at immediate relief of back pain and or symptoms that extend down your leg. However, studies have shown that it may accelerate degeneration of the disc above and below the fused level. And the newest on the list is a disc replacement surgery. This is being used as an alternative to spinal fusion, where the fusion permanently restricts the motion at the spinal level. The replacement allows for normal or close to normal mobility by implanting a mechanical device that will replace the function of the disc. This, therefore, decreases the amount of stress and degeneration of the vertebrae and the discs are above and below the surgical area. Since this is a newer procedure, I would seek consultation with a trained and experienced surgeon if you are considering this option. There you have it. Those are the most common surgeries, but as always in medicine, new procedures and surgeries are being developed all the time. So talk with your doctor about any surgery he or she is considering prior to going under the knife, because you want to make sure you understand the risks associated with the surgery. I hope you never need these options, but if you do, I hope this video was able to help and provide some information on those topics. Until next time.